I will talk about learning and opinions from Sweden regarding biomarkers for Alzheimer's disease. And we have been using biomarkers in clinical practice for quite some time. And I will share our experience with you from that work. If we start by defining what the diagnostic biomarker for Alzheimer's disease is, according to most definitions, fluid biomarkers for early Alzheimer's disease diagnosis in Sweden, we have Swedish national guidelines. They have been developed and they are based on clinical diagnosis of Alzheimer's disease. But in all these guidelines, we have implemented that in cases where a clinical diagnosis for one reason or another is difficult, then you can use biomarkers to support the diagnosis you are making. Now I will present a case to you. And this patient is a 70-year-old retired man, and he is actually being screened for eligibility for entering a clinical trial. He was diagnosed with Alzheimer's disease already in 2014 using clinical criteria, and that was mild Alzheimer's disease dementia. His MRI scan of the brain, magnetic resonance imaging of the brain, showed no atrophy or white matter changes. CSF analysis showed slightly elevated CSF serum albumin ratio as a sign of impaired blood-brain barrier. Normal cell counts, elevated total tau, which is a neurodegeneration marker, and normally beta-42 concentrations. So again, this is not completely typical of Alzheimer's disease, but a little bit of abnormalities that indicate that it could be a component of Alzheimer's disease here. The past medical history, some years before the diagnosis, the patient started to complain of cognitive decline, and this progressed over the years. Now it's 2018, and the patient comes back to be screened for potential enrollment in a clinical trial of an active immunization against beta amyloid. What really stood out was the CSF monocyte cell count. So 108 monocytes per microliter of CSF, that is way too high. It really indicates active inflammation, which can't be explained by the Alzheimer's disease process. Serum Borrelia antibodies were negative. In CSF, they were positive. And the CSF Alzheimer biomarker pattern revealed elevated total tau, elevated phospho-tau, and reduced beta amyloid. So if you recall the earlier CSF-AD biomarker results from 2014, they were not conclusive, but now we have clear evidence of underlying Alzheimer's disease. But on top of this patient also has contracted neuroborreliosis. The patient has two diseases, Alzheimer's disease and neuroborreliosis. To conclude here, we have a neurochemical picture of the patient consistent with neuroinflammation and an active Lyme disease. There are biomarker evidence of Alzheimer's disease. The patient underwent doxycycline treatment against the neuroborreliosis. Cognitive decline continued during the follow-up. So the patient had contracted Lyme neuroborreliosis, and this could have, I'm thinking about this particular setting, the patient was just about to be enrolled in a trial with active immunization against Alzheimer's disease. If the neuroborreliosis had gone undetected, then we would have had a very hard time to know if the neuroinflammatory picture developed was on the basis of the treatment that was tested out or something else. And I'm afraid that this could have been misinterpreted as a side effect of the active immunization, and that Lyme neuroborreliosis would have gone undetected. This type of Lyme disease, it is not good for the brain to have it. Most often you have other symptoms than cognitive deterioration, but cognitive deterioration can be part of neuroborreliosis. So what we think we learned from this case was that biomarker assessment prior to enrollment in clinical trials could help exclude patients with underlying conditions that could mimic or aggravate symptoms of Alzheimer's disease, or that could be misinterpreted as side effects of the treatment. Can we be confident in the use of biomarkers to detect early Alzheimer's disease? So if one would sum up this, there are opportunities for global use of biomarkers for Alzheimer's disease. Fluid biomarkers have the potential to enable more effective clinical trials and establish a more personalized approach to Alzheimer's disease diagnosis and treatment. Thank you very much.